Hello, everyone. We're just going to get started here. I see quite a few people just joining now. My name is Grace Van Mill, and I'd like to welcome you here today on behalf of the Manitoba Council for International Cooperation to today's webinar on reducing the risk of sexual exploitation and abuse during crisis with Digna and Save the Children. So thanks for taking the time to join us today to discuss these important issues for our sector. As we begin, I want to acknowledge that I'm joining you from Winnipeg in Treaty 1 territory, which is home of the Anishinaabe, Cree, Ojibwe, Dakota, and Dene peoples. And of course, we're on the homeland of the Métis Nation. And I think it's important to note that wherever you're joining from today in Canada, we acknowledge that we're joining from the traditional territories of many Indigenous communities, and we're grateful for the chance to do so. And before I introduce our speakers, I thought I'd go over a few quick things with you. So we're doing this webinar style, so you'll be able to see the speakers, but not other participants. We do have a Q&A section set up that you can see on the screen here. We're pointing to where you would put your Q&A questions. If you have questions at the end or as we're going through for Brigitte or for Kate, please put them in there, and at the end, we'll make time to answer your questions. You can look at questions from others and sort of like or upvote the ones you want to see answered. And we'll be launching also periodic polls throughout the webinar, asking questions of you so that we can connect with you and learn from you during this presentation. So I think I'll just launch the first poll and see to make sure you can all access that. So in just 1 second here, you will see a poll pop up on your screen. We're just curious where you are implementing programs at this time. So I'll give you a second to answer that. It is nice to see so many of you joining today, so thanks for that. So whenever I do these webinars, I always think it's like election night. I can see the results scrolling in, so thanks everyone for participating and letting us know where you do your programming. So just as you're filling out that poll, I wanted to let you know that the chat function is also enabled in this webinar, and I'll be monitoring that during the presentation. We just wanted to give you a heads up that at the end of the webinar, all chats are sent to the host. So even if you're sending a message to someone else individually, we will get a record at the end just to give you a heads up on that. We're also recording the presentation today, so any questions read out will be a part of that recording, but we have enabled anonymous questions, so your name will not be read out, but your question will be. So I'm just going to share the results of the poll question. So a lot of you are involved globally, a large group operating in Africa or sub-Saharan Africa, and then around the world. So thanks for that. I can see you're all Zoom pros and you know how to do the polling. So I think what I would like to do now is just give you a little introduction about MCIC. So for those of you who might be less familiar with MCIC, the Manitoba Council for International Cooperation, we're a council of about 40 organizations working in international development around the world. And we support, connect, and amplify the work of our members and partners. We host learning opportunities like this from time to time. And it's important to note that this webinar is sponsored in part by funding from Global Affairs Canada. And so we're very grateful for their support. I'd like to thank our partners and presenters today, Digna with CCIC and Save the Children as well. The agenda is coming up now on the screen, and that's here for you while I introduce our speakers. So I'll just ask our speakers to make their videos active as I introduce them. So the first presenter will be Brigitte Demers. She is the Digna Manager for CCIC. That's the Canadian Council for International Cooperation, as many of you know. Digna is the new Canadian Centre for the Prevention of Sexual Exploitation and Abuse, or PSEA as we all call it, in international cooperation. Brigitte is a devoted expert in gender justice, collaborating with civil society partners to prevent gender-based violence, or GBV, and mainstream gender equality and human rights approaches. Brigitte has completed graduate studies in critical criminology, and she's pursuing PhD studies at the Institute of Feminist and Gender Studies at the University of Ottawa. Her interests are focused on international collaboration for transformative changes on GBV norms. And prior to joining the CCIC team, Brigitte implemented frontline community intervention programs with families experiencing violence or neglect, and she also taught at a branch of the Université du Québec. So in her 20-year career, she's operated as a gender and human rights consultant for organizations in Mexico, implemented a multi-level intervention program for rural women in Chile, and conducted several research projects while training a variety of actors on related topics. So we're looking forward to hearing from you, Brigitte. And then I'll just introduce Kate as well, who'll be speaking later. Kate Butler is the Child Rights and Protection Advisor at Save the Children Canada. You can see her now on the screen. And she sits on the steering committee of the International Child Protection Network of Canada. She's passionate about children's rights and child safeguarding here in Canada and around the world. Kate has over 13 years experience as a researcher, human rights advocate, and educator. She holds a PhD in sociology from the University of Victoria. And during her work at Save the Children Canada, she is responsible for building capacity, developing materials, and measuring and sharing what works as it relates to child rights, participation, and protection. So I know we're all looking forward to hearing more from these experts on the prevention of sexual exploitation and abuse. And I'd like you to join me in welcoming Brigitte to start. So Brigitte, if you want to welcome her, you can do that by putting a plus sign in the chat as applause. So we're just gonna let Brigitte get started here, and then we'll turn things over to Kate in a minute. So Brigitte, over to you.
Thank you very much, Kate. Hi, everyone. Yes, I want to make special thanks to Kate and MCIC for organizing this webinar with CCIC and Save the Children. I am delighted to be here today. It's a great moment, and I'm happy to see how many of you have registered. Thanks to everyone. I think that Kate mentioned it, but the PowerPoint will be shared at the end of the webinar. So don't worry if you wanted to take notes. It's all going to be available after the webinar. Before starting the presentation, I want again to present you Digna, the Canadian Centre for the Prevention of Sexual Exploitation and Abuse in International Cooperation, funded by Global Affairs Canada. Digna's mission is to contribute to organizational culture change within the Canadian international cooperation community by providing online resources, training, and consultation services to enable organizations in the sector to adopt gender-responsive best practices to prevent and address sexual exploitation and abuse in their operation with their partners, and particularly towards women and girls. So we're very happy to present you Digna today. In my presentation, so I will first look briefly with you at some definitions. Second, we will review some of the factors affecting SEA in period of crisis. And I will finish by providing you with documents to further your implementation on PSEA best practices. As Kate mentioned, we'll have some polls during the presentation, and this will help us. I want to thank you also for your answers. It will help us better tackle your needs. And I want to say that the answers are confidential. We don't know who says yes or who says no. So don't worry, it's not going to be going to anyone. So a few definitions to start with. According to the UN body, sexual exploitation is defined as any abuse of a position of vulnerability, differential power, or trust for sexual purposes. This includes profiting monetarily, socially, or politically from the sexual exploitation of another. UN defines sexual abuse as actual or threatened physical intrusion of a sexual nature by force or under unequal or coercive conditions. Internationally, we differentiate between SEA and sexual harassment, sexual exploitation, abuse, and sexual harassment. By sexual exploitation abuse, we refer to behaviors that occurs when a position of power, such as being a staff member of an NGO, is used for sexual purposes against a beneficiary or vulnerable member of the community. For sexual harassment, we refer to behaviors that occurs when differences in power are abused between staff members. While all of these behaviors are against human rights and totally unacceptable, sexual exploitation and abuse, as we just described, are victimizing beneficiaries of international Canadian assistance, and Digna aims specifically to support you in protecting them. Yeah, so now I would like to highlight some examples, some factors that make SCA increase risks and need for prevention and protection increased. In this specific time of COVID-19, as we all know, many around the world are confined. This confinement is known to increase significantly intimate partner violence and decrease accessibility to resources. While I know that gender-based violence or other kind of violence is not the focus of many of your organizations, I believe it's important to be aware that beneficiaries, partners, and staff that you work with may be going through these situations while in confinement, and we need to be ready to orient them towards proper services. Time of crisis also facilitate the sex trafficking of women and children and is to be considered in our analysis. There is more need for protection, and at the other hand, many people are acting on front line of the crisis, so protection is less available. So also to be considered. In a time of crisis, and particularly COVID-19, we can see less access to reporting channels as people are confined. Also can increase sexual exploitation and abuse to happen and need of protection when non-gender responsive pandemic control measures are offered. So in the responses, we have to adapt a gender approach to services. And this period also increase transactional sex for food, shelter, or any type of assistance as a coping strategy. So all of these are to be taken into account when we make our strategy to prevent sexual exploitation and abuse in time of COVID-19. These are different mechanisms to implement to PSEA. So the international standards of PSEA best practices includes having a code of conduct, training on the code of conduct, and disseminating it. Conducting evaluation of risks and mitigation measures available, having a system of complaints, survivor-centered support services, sorry for my English, investigation of allegations procedures, national and international coordination, and system to monitor, evaluate, and be accountable to the public. This may look overwhelming to do at a time of crisis. So we'll start with the first questions, and then we'll see what measures we can put forward to address this, these measures.
Just to let you know, the polling is at about 60%, so we'll just give it another 30 seconds or so, and then I'll make the results live. So I'll just put the results up there on the screen for you, Brigitte, if you wanted to discuss.
Okay, so as we see, many of you have a code of conduct, a focal points person in your organization. If you haven't yet, please send us the coordonnées, the phone numbers and where we can reach you. And if you don't, okay, so do we still see, sorry, do we still see the focal points or, okay, here. Okay. So please, if you have and haven't communicated to Digna the name and the data of your focal points, please send them to Digna info@ccic.ca. And if you didn't, I do encourage you as a first step to identify your focal point in your headquarters and also in all your country unit program. So all of what has to be done for PSEA may look overwhelming, as I was saying, and we could ask ourselves where to start. Well, actually, we can start anywhere. So this is where you have number one everywhere. So identify your focal points. Here, this links will give you some terms of references for focal points. If you don't have a code of conduct, ACOSI has put together a template to help you go through it and remind everyone often that sexual exploitation and abuse is not accepted, is tolerance zero in your program, and who is your contact point. These are first ways to act.
Brigitte, sorry to interrupt. There was just a question about identifying the focal points, and there's just a question about the connections to the UNHCR. They just want to clarify, should they identify their focal points to the UNHCR or to you, or how should they identify them?
I would say to both. I think it's different. When communicating to Digna, we will communicate and create a community of practice and inform you of all things that are coming up to prevent and address sexual exploitation and abuse in your programs with your beneficiaries. But to communicate it also to UNHCR is making available with other countries' organizations to know, because we will see another, like I'm going ahead of my presentation, but coordination, national and international, is important in time of crisis. So sometimes if you don't have focal points available and there's a situation that happens, it's good to know that there's another focal points available. So this is what is the list useful for. And the other way around, if you do have somebody that knows how to protect and address sexual exploitation, and somebody from another organization, another country comes to you, of course you will offer attendancy and orientation. I hope this answered the questions. So I would say both, please, for different purposes. So back to the presentation. In time of crisis, risk and mitigation measures are different. So if you haven't done it yet, I strongly recommend you to do a gender-sensitive analysis involving women and girls of the needs and consequences of your program activities and context in the period of COVID-19 specifically. So if you did one before the pandemic, I really encourage you to do one right now. Some questions to reflect on with your field team would be, what are the SEA risks in your organization, in your programs? How does COVID-19 affect beneficiaries? How are COVID-19 assistance services available? What risks does accessing them present? So here we'll have another question for you. Does your organization have a code of conduct on sexual exploitation and abuse?
So you should see the results there on the screen.
Yes, well, congratulations, because over 80% of participants have a code of conduct. So this is very good. For people that do not have, if you don't, and sometimes again, in time of crisis, time is low. There is these 6 core principles put together by the Interagency Standing Committee that that you could start with in your code of conduct. So we'll read them just briefly. Sexual exploitation abuse is a gross misconduct and grounds for termination. Sexual activity with children is prohibited. Exchange of money, employment, goods, or any kind of services for sex is prohibited. Any sexual relationship between providers and beneficiaries is prohibited. We all have obligation to report suspicions or concerns on sexual exploitation and abuse. And we have all the obligation to prevent and address sexual exploitation and abuse. So these are 6 core principles to start with for the 10 to 20% of you that don't know or don't have a core code of conduct yet. We have here another question for you. So would you say people in your organization mostly know to whom and with which procedures to make a complaint in case a situation of sexual exploitation abuse should arise? So maybe just to, for some people that would not be so familiar, SEA means sexual exploitation and abuse, and PSEA stands for prevention and sometimes protection from sexual exploitation and abuse. Okay, so again, 70% would know who and how and which formula to make a complaint. That is very good. 11% don't know and 20% do not have a way. So this is things that we can make available on Digna's website, tools. I'll be talking about that a little later, and to help revise, review, or make available a process for complaints. We'll continue. So in time of, we've talked about coordination before, when you asked to whom to send your focal points information. So coordination becomes even more important in time of crisis. I invite you to, one, be aware of and disseminate the survivor support services available to your beneficiaries in country. And if you have these information, please share them with Digna so we can share them with all organizations. Ensure people in remote location have access to reporting a SEA case. Make key messages visible, adapted, translated, disseminated. So for example, all kinds of aid is free. No one had to choose between food and security. Zero tolerance to SEA. So, and many others. So make the message often visible. Also make focal point numbers or contact information available everywhere. I mentioned that it's important to recall often the need to prevent, and sometimes you might feel that it's awkward to say it every time that you start a Zoom, but you never know when is the moment where a survivor or a person that is witness will grab the opportunity to come to you and say, hey, there's a situation. So I think it's important to make it extremely visible. It's never too much. And it's important to protect the beneficiaries of our services. Another question for you: as your team received a training on PSEA in the last 12 months? While you answer that, if you're already done, you can share with us in the chat box what kind of trainings you would particularly need for your organization.
Okay, so we've got just a few more seconds for people to fill out the survey. And then Brigitte, could you repeat your question for the chat?
Yes, well, if you have a specific need in your organization for a specific training on PSEA, well, Digna will be putting out training, so we're happy for you to share those needs with us in the chat. Is that clear? Okay. So a lot of you haven't had training in the last 12 months, and 30% did. It is important to refresh trainings often because it reminds us, of course, what is acceptable, non-acceptable, and how to go around with the different steps to address and prevent. It also gives us an opportunity to make the culture change in our organization and to also update any in the monitoring evaluation process, update any information that would not be useful anymore. So again, since a lot of you have not had these trainings in the last 12 months, don't hesitate to tell us in the training what kind of training would be your priority need. Here I have like training in time of COVID-19. So training is sometimes something that we don't have time for when everything becomes suddenly urgent. I recommend this link here. You'll have it when we share the PowerPoint. It's a 6-minute training in emergency settings. It's very simple. It's available in many languages, and it's sensitized the beneficiaries of Canadian aid or international aid that sexual exploitation and abuse is not accepted. There's also a link to a 101 training on PSEA that was developed by a United States organization called Interaction. So you can have a look at that. Also, it's quick and it might give a basic training to your team very fast. Okay, so another one. Have you signed the CCIC Leaders Pledge? Okay. Okay, so if many of you haven't signed the CCIC Leaders Pledge yet, so I encourage you to review these commitments going on CCIC's website and consider signing it to commit to implement PSEA best practices in your organization. And if you want to join a community of practice on step-by-step to prevent sexual exploitation and abuse, I also invite you to register in their mailing list by clicking on Digna right here. After when you get the PowerPoint, of course. And this is the last question for you. Does your organizations have policy and procedures to investigate in case a situation of SEA should arise? Okay, so it's very interesting to see the answers to the poll question. So 70% do have policies and procedures. So it's very interesting, and I will be further talking about upcoming services. So it will be interesting that we share and learn from best practices and all the way you are using these procedures all over Canada. for the ones that do not have or would like to review, I would like to share with you these documents that will permit you to further implement and to review your own procedures to proceed complaints mechanism, to treat investigation, to offer survivor services, etc. And on Digna's website, we will have a toolkit coming out next week that will give you templates, guides, checklists to see if you'll be able to see if your investigation procedures is according the best standards. So a click and a tick. So you'll have that coming up for next week. So look forward in our website to that. So yeah, so that is all for now. I will turn over to Kate that will tell you about how to protect children from SEA, from Save the Children and back to Grace. And after, I will be back to talk more about Digna's services.
Okay, I can see Kate's here and ready to go. So Kate, we'll just turn it over to you. And just feel free to say next slide when you need the next slide.
Great. Thanks so much, Grace, and thank you, Brigitte, for that really interesting and thorough overview of PSEA during the COVID crisis. As was mentioned earlier, one of the things I do in my role as sort of the lead point on child protection and child rights at Save the Children is I get to sit on the International Child Protection Network of Canada. This is an organization made up of lots of different organizations that come together to talk about child safeguarding issues. And so we've been talking a lot with Brigitte these last few months about how we can sort of bring some of these conversations about the risk of sexual exploitation and abuse during crisis to, broader questions about child safeguarding. So let's dive in. Next slide, please. Yes, we want to talk about keeping children safe during COVID. I want to recognize that many of you have probably been thinking and hearing a lot about child protection during the COVID-19 crisis. So what I'm trying to do today here is I may not be reinventing the wheel, but just sort of providing some food for thought and hopefully, some jumping off points for discussion within your own organizations about child safeguarding and what this, what this crisis really looks like for children and what our role is in the INGO world in keeping children safe. Next slide, please. So in short, child safeguarding means to keep children safe. We have to know how to respond to child safeguarding concerns overseas, and organizations are responsible for socializing and normalizing these policies. Again, my guess is that many of you know this. Next slide, please. This all relates to child rights, of course. For me, all my work is grounded in the Convention on the Rights of the Child. We know that states have a responsibility to keep children safe from all forms of physical or mental violence, injury or abuse, neglect, maltreatment, exploitation, including sexual abuse. So do responsibility bearers, so do organizations like ours. We work in tandem with the state in many cases to ensure that children can realize that right to protection. And so this has been going on for a long time. The sort of explicit focus on PSEA, which is very welcome and very needed, builds on, I think, a larger, broader conversation about rights and picks up on things we've heard in the child safeguarding community before. And so it's great that we can see how child safeguarding and PSEA connect and are part of a broader safeguarding conversation. Next slide, please. So I think for me, the big difference between child safeguarding and child protection and what we're here to talk about today is harm by our organizations, one of our workers, partners, or volunteers, representatives, or casual workers, and how we are affecting children versus these broader protection issues that happen in the world. And so we want to focus on what we can do within our organizations to ensure that all children that come into contact with us are safe. Next slide, please. So my first poll question for you is agree or disagree with some variations of gray. My organization has a formal child safeguarding policy that is regularly discussed and socialized. I'll give you a few minutes to answer.
So just to let you know, we're just at about 60% of the vote, so might need a few more seconds.
Great. Okay, interesting. So we have about half the people, or just over half actually, saying they agree or somewhat disagree. So sorry, agree or somewhat agree with this statement, and just over half that disagree. And I think that this is probably because we're from all sorts of different organizations here. I'm thrilled to see about 125 people online, and so I'm sure your organizations are of differing sizes. I would say for those of you who are working explicitly with children, if you don't have a child safeguarding policy, this is something I would definitely consider, and I would urge you to reach out to either Brigitte or myself, and we talk to you about this in more detail. So please do feel free to reach out. Next slide, please. And my second question, and I have this phrase as my organization has discussed the challenges of child safeguarding during COVID. Let's expand that. Let's say my organization has discussed the challenges of dealing with young people during COVID-19. Maybe you don't use the phrase child safeguarding, and that's totally okay. I come from a domestic child rights background, and sometimes we use other phrases. So have you discussed the challenges for children that you come in contact with during COVID? And I do realize that some of you are from universities, so this would be slightly different too, but we do know that there are, of course, children on university campuses as children of students, as children of faculties, in childcare programs, and lots of volunteer, your students can interact with children, so it's not just the population that you directly serve. We'll give it another second or two, maybe, Grace, and then we'll close the poll. Okay, so yeah, again, it looks like in this case, only about a third of the people agree that they've discussed some of the challenges around child safeguarding during COVID, and 2/3 haven't. So why don't we spend the next of our few minutes here together, getting a chance to go into some of the particular challenges in more detail. So we know that coronavirus is affecting children or communities all over the world, and what I've sort of pulled out here are some of the lessons we've learned in the international NGO world, especially at Save the Children, but also with my other partners who work on child protection across the Child Protection Network, and infectious disease. So first of all, children may have specific susceptibilities to infection during these outbreaks. We know that's actually not the case in coronavirus, or at least from what we've seen so far. So we're less worried about that one, but it's still an important point when we talk about infectious disease outbreaks. Second, and importantly, infectious diseases can disrupt the environments in which children grow and develop. This is certainly something we're seeing, and we'll go into that in a bit more detail. And finally, measures used to prevent and control the spread of infectious diseases can expose children to protection risks. So let's make sure we talk about those last 2 points in a little bit more detail. Next slide, please. I wanted to draw on some of the learnings from past infectious disease experiences. I see in the comment box we have some people who look like they're programming in Sierra Leone, so I'm sure they probably have quite a bit of knowledge about this particular example I'm going to draw on. But the Ebola outbreak in 2014 to 2016, it's actually a pretty good example when we're thinking about coronavirus and the effects on children from a child safeguarding lens. Like, how can our organizations make sure that we are receptive and that we are handling these concerns in a responsible, rights-based way? And so I just want to pick out a few of these points here, and then we'll move along. So at the height of the epidemic, 5 million children were affected by school closures in West African countries, including Liberia and Sierra Leone, and poverty levels rose. There was certainly a gendered lens here. We know that a lot of girls dropped out of school and they didn't have an opportunity to engage in the virtual learning that was maybe supplied in some cases at home, some kind of distance learning. I know, at least for my organization, we're talking about ways that we can reach girls in Sierra Leone and Burkina Faso and lots of other places all over the world. And we have to remember that not everyone, even at home, is going to have access to those same educational resources or be able to participate. So we need to ensure we incorporate that gendered lens into our analysis. The closure of schools increased girls' vulnerability to physical and sexual abuse. So again, there's a real gender element to the protection challenges faced by kids during infectious disease outbreaks. Next slide, please. Adolescent pregnancy increased. We also know that early marriage increased. Those two are very closely correlated. So many of these girls never returned to the classroom. There was a recent change in law, some of you may know this in Sierra Leone, that now allows pregnant girls to attend school. However, we do know that this really affected the number of girls that were able to attend school, and this had long-term effects for them. And finally, the education system, which could have been a really preventative factor in helping these girls stay in school. It didn't necessarily have the resources it needed to act as that protective factor. So next slide, please. So I bring all that up because I think as we think about COVID-19 around the world and what this looks like from child safeguarding perspective, we need to remember that a lot of these challenges are real and are going to have a direct impact on the lives of girls and of boys all over the world. So first of all, disrupted environments. We know that the home environment will be disrupted. This could mean an increase in violence within the home. It could also mean loss of income for parents and how that will affect children, as well as a lack of privacy. When we talk to young people, and this is true of conversations with Canadian young people as well as young people around the world, and we know that a lack of privacy is a really big one. If you think about the youth and teens in your own life, that may resonate with you. And for children, it can be very troubling to not have any privacy or to have very limited privacy when we're all stuck in these social isolation patterns. Second, friends and peers groups. So there's, the loneliness element, perhaps the boredom element, but we also have to remember that friends are a protective factor against gender-based violence, against violence against children, and having friends and having those connections and that peer support outside the home is incredibly important. So we need to make sure that we just need to recognize that this may not be a support that young people are receiving during the COVID-19 crisis. And third, in terms of disrupted environments, I'd also like to talk about communities. We know that child protection systems may not be receiving all the sort of oversight that they are used to. Case management systems may be impacted, health systems. So for children who may, regularly come in contact with the health systems, they are not able to do that either. Unfortunately, they're not able to connect. So communities will certainly be disrupted. Next slide, please. Next slide, please, Grace. I think there was one slide before, sorry. Great, perfect. And so measures used to prevent and control the spread of coronavirus may actually expose children to protection risks. And some of these were mentioned in the previous slides, so I won't go into too much detail. But again, we know that isolation can be a really important and effective strategy to slow down the spread of coronavirus. But I just want us to be really careful that if and when those measures are in place, we are trying to mitigate the child protection and child safeguarding risks that will emerge. Secondly, there's limited access to outside adults. I don't know if you've seen in Canada, there's kind of a push by some children's rights groups to have conversations with other adults who can support them during this time. Again, it's hard when you're isolated all by yourself, just with your family. So remembering that, even as the social isolation is helpful. Finally, schooling goes virtual, so who's able to access that? In some contexts, girls may not be encouraged to do so. We know that kids with some disabilities may be sometimes left out of distance learning unless the programs are implemented properly. And then fourth, this increase of gender-based violence and other forms of violence, and just the lack of support for people. Next slide, please, and my last slide. Oh, I think, yeah, perfect, recommendations. So I encourage you again to look at Brigitte's slide about sort of the steps that we can take and the different ways that as organizations we can ensure that the policies that we're supporting, the programs that we're implementing, have this lens towards stopping sexual exploitation and abuse for adults as well as for children. Here are just some of my recommendations for you as you think about your programs and your projects around the world. So first, be prepared for different stages of the crisis. We know that this will likely likely be a up and down, right? We may see a first wave, and then we may see a period where it looks like we have this under control, and then a second or third wave of COVID-19. And so just being aware of the different challenges that will come both during initial social isolation phases, the reopening of schools, perhaps the reclosing of schools, and the stress on child protection systems. Second, in your programs and your projects, I encourage you to try to ask children themselves how they are feeling and doing. I've seen some early results of surveys with children and youth around the world on how they're doing. This is both within Save the Children as well as other organizations I know are doing this too. And there's certainly evidence that children are experiencing heightened mental health crises during this time. So we really, encourage you to ensure that they can connect that they have a voice and are able to participate in decisions. Third, ensure that child protection systems are considered essential services whenever possible. So this is something that's happening in Canada too. We're having conversations about how do we ensure that those people who are on the front lines of dealing with children are considered essential services so they can go to work, so that they can access childcare if they need to go to work. And this will allow us to have as strong systems as possible for children who face violence or who face other challenges. Fourth, work together with others in the community. So, many of you are probably familiar with a cluster approach in some of the countries that we work in. So we work with other international NGOs on issues around education, around child protection, around gender. Continue to do this. We think this is a really important way to ensure that child protection doesn't fall through the cracks. And finally, be nimble. So have the ability to pivot programming if it's not working. Work with your, donors, your funders, if and whenever possible, to illustrate why it's important to have that flexibility built into your programming. Next slide, please. And here's just some final resources that I encourage you to check out. There's a lot right now on COVID-19 and child protection and safeguarding, so it is a good time, especially if you don't regularly talk about child safeguarding, to think about your own policies within an organization and how this affects your programs and projects. Thank you very much. Back to you, Brigitte.
Did you want to say something, Grace? Okay, so in these last minutes before we take a few questions, we're going to do that fast. I wanted to present you services that are coming up for the sector at Digna. So we'll have a website that includes resources databases, questionnaire from GAC requirements, country sheets for survivor support in country, community of practice, best practices and case studies, and yes, training and online and in person. So look up. Also, I want to share with you some people have offered to get involved in the chat. So send me write me an email if you want to get involved. Digna has put together many working groups, and they are working hard for you, for the sector, and will make available and address many of the questions. So lastly, I want to say, so has the Canadian International Cooperation Sector, let's be worthy, let's be Digna. Back to you, Grace.
Okay, thanks very much. So I just want to thank you both. Those presentations were really interesting, and I think you can see on the screen right now that there's a spot for you to type your questions in the Q&A. So we've had quite a few questions come in, so I think we'll just get started and let people add more questions there. And don't forget, you can vote for questions that you'd like to see answered. So one of the first questions, which could be answered by Brigitte or Kate, they're talking about cases of sexual exploitation and abuse and how they're perpetrated often by aid workers or development workers, and that the burden of informing tends to be on the survivor. So they're wondering if there are any training or monitoring tools to help aid or development staff to identify if there's potential sexual exploitation and abuse occurring within their organization. For example, things to monitor while on a project monitoring trip. Are there tools or resources available for that? And any other resources in that vein?
Did you want to say something, Kate, on that? Or?
You go first, go for it.
Yeah, okay. Well, what I want to say first is that if you have suspicious suspicions, you have to report them. And sometimes we're wondering if we're right or wrong, and we don't see all the iceberg. So we need to be very careful with a ticking box of, is it a situation that I should report? Should I be wary or not? We can evaluate risks of happening and mitigate and prevent and make this situation. But if you have doubts, well, it's not to you to evaluate if your doubts are valid or not. It's to the system of investigation. So please put a complaint that will be in process appropriately if you have doubts. That would be my answer.
Yeah, if I could just quickly add to that, I have two comments. First, I think if you're going to do a site visit abroad, it's great to talk to local staff on the ground and say, what are things I should watch out for? Okay, is there a high prevalence of child early forced marriage? You know, like, what are things that I need to be looking out for? And then, as Brigitte says, document that in any way you can. And second of all, you know, I come at this from sort of a child and youth perspective, and I think we all can do a better job of having accountability mechanisms in place for young people and probably for women too, to report these incidences. I do hear your question about it. The onus should not be on the child, youth, or victim. However, I do think we can have ways that are more child-friendly, youth-friendly, and gender-sensitive so that people don't feel like reporting is getting them in trouble. But I really thank you for the question.
I want to, I agree, thanks for bringing it, Kate, that every country is different, but the country managing of it and the organization, so there's different level of managing with the headquarter and the local to make sure that we keep everybody safe.
So the next question, and you can put in the chat if I'm not getting your question correctly here. There's a question about what can we do to ensure we have services available for people such as cleaners in offices who are in vulnerable situations? How can everything be clear and visible and safe for everyone? This may have been specifically to a slide when you were talking about certain things, but I think they're asking how they can protect people in vulnerable positions in projects.
I guess for me, one of the things I would echo is working with local partners to ensure that whatever resources you're putting up around that office so that cleaners are looking at it, make sure it resonates with them. So have pictures that work, use local dialect. I definitely think it's a great question, and I think that you need to just, you know, as you, I think you're implying in the question, be sensitive to the fact that not everyone comes to these buildings or locations with the same sort of background or resources. So ensuring that our policies are accessible for everyone.
Yes, and if I add something to that would be that when you make an analysis of the risks, always do it with the people that are in the vulnerable situation. They will point out ways to put lights. So each context, the analysis of the context is important, and involve the person that you think are mostly at risk. Also, make the information available everywhere you can, not only in posters, but in every opportunity that you have. Yeah.
Okay, we have another sort of comment and question here about obligations to report. So this person is saying that zero tolerance policies sometimes risk freezing reporting as vulnerable people might be afraid of consequences. So they're talking about how it's crucial to have a list of sanctions that can be tailored appropriately and transparency about how complaints are handled and how that's recommended by UN Women. So I think they're just asking you to discuss that a bit in terms of what are your obligations for reporting? How can you ensure vulnerable people aren't afraid of consequences? And what are some appropriate sanctions?
Very good questions. Thanks.
Many questions in one question.
Yes, yes, very, very good questions. Well, the obligation to report has many layers. Sometimes people refers to the obligation to report to GAC. So before there's a procedure on their site, but there's always also a complaint mechanism evaluation, and once before it gets to GAC. And you should report any judged serious case to GAC. And you should have also mechanism for as important, they're not less important situation, but so that people have places, safe places to discuss situation that your system investigation, internal investigation system might qualify not serious enough to go to another level. In all these situations, of course, we have to take a survivor-centered approach, and sometimes it is useful to, and we are talking about that with the GAC partners, to include in your programming some session to openly discuss about it without tackling anyone. So this makes for people to culture change, to sensibilize to what is acceptable, not acceptable, what to do at what level, when, with whom. So it is important to have very many layers of intervention. And it's not necessary that you have a little doubt and then you go to court. So there's many steps between. So this is why in my presentation, I was asking if you have a system of procedures for treating the complaints. So this is partly the answer. I'm not sure I have addressed all the matices in the question, but that'd be, yeah.
Okay, I just want to make sure I give Kate an opportunity. If you had something to add.
Not really. I guess I would just add, as someone who follows Digna and Brigitte, she's a great resource. So I think me, and I hope many of you others, people will ask her as well when you have these questions, because she certainly is helpful.
Yeah, and so I'm mindful of the time. We only have a few minutes left, so we will address one or two more questions, and then we will also, just to let you know, your questions will not disappear. We will save them and share them with Brigitte so that she can address them in future Digna work or emails, so you can get your questions answered. So the next question I see here is, how can you do gender-sensitive analysis in action during this digital space? So I think they're asking, how can, in this time of COVID-19, when a lot of people are working virtually and in other ways, how can you still do gender-sensitive analysis?
We definitely have to get creative, as we all are. We all are inventing new ways in this time of doing everything by Zoom. And the community we work with don't necessarily has equipment to Zoom in to a meeting. And this is for one. For second, in analysis behind a screen, a woman or a girl that is living a situation might not be allowed to say anything. So the gender analysis would be not necessarily totally reliable. So yes, there is many challenges, and it depends of every project and the way you are linked with your partner on site, on the ground. And what is the women organizations already doing? And like we said, some countries are more dangerous to address it, and some others are more open, and women are already very organized, and you can partner with specialists on the ground. So yeah, so I think we have to be mindful very much that if we involve women and girls behind a screen that is in situation that should not talk, she won't talk. So just be aware of that. And the other thing I wanted to say about that is that Digna really wants to be a collaboration from the sector. So we don't have all the answers. I don't have all the answers, but I really like the questions, and it's places with Digna, with the community of practice, to discuss it and to find creative solutions to these problems where it's a new situation. So thank you for the question, and we are taking them and trying to reflect them and invite people to feed in as well.
Yes, and we have another question here. It's possibly directed to Kate. Are there available resources to tackle online child sexual exploitation and abuse that is more pervasive during, possibly more pervasive during COVID-19?
Yes, there definitely is. There's a few different places I would recommend looking. Maybe what I'll do is I will, rather than just sort of spelling out, I'll collect them and send them to Brigitte, and she can send it out with the newsletter or with Grace, just so I don't miss anything.
That sounds great. So Brigitte will pass that on at a future time. So I think we've addressed the majority of the questions here. There are some sort of follow-up questions about the community of practice you mentioned and workshops that were originally scheduled. And I think those things will probably be addressed in future e-newsletters. Is that right, Brigitte?
Yes, that's right. And I see questions about trainings. So you will be informed if you have give your email, you will be informed of trainings coming out. We will do more online for this period, but there will be also, as we disconfine, more in-person trainings. And again, the community and the working groups are working very hard to put out and to answer many of your questions. So really stay tuned, come on the website often. There will be some legal answers. There'll be everybody's working hard to make the information available and the sources.
Yes. And for people who put in specific questions about templates, policies, checklists, I noted a few of those questions. We'll be sure to pass those on to Brigitte. So your questions will be answered. Just one final question that came up while you were speaking about the Leaders Pledge. People are just asking to clarify, can they still sign the CCIC Leaders Pledge?
Absolutely. The Leaders Pledge you can sign all the time if you haven't signed yet. And we will also be having steps towards completing the commitments. So yes, I invite you to sign the pledge. It's never too late.
Well, I think we'll end the Q&A there. And if your question didn't get answered yet, we'll be sure to share it with Brigitte or Kate as needed. In conclusion, we just want to thank you all for attending today as we learn about the new Sector Hub from Digna, how to keep children safe in crisis, and those best practices for the prevention of sexual exploitation and abuse moving forward. We are going to follow up. You'll see in your email an email to participants with a copy of today's PowerPoint, links to some of the resources that were mentioned, and the presenter's contact information. And of course, a short evaluation of our webinar. It's important for us to hear your feedback on this event. We'd appreciate it if you'd fill that out. So I want to say thank you to Brigitte and Kate for sharing their expertise with us today, and to all of you for joining. You can put some plus signs in the chat if you enjoyed today's session. That's our applause, our online applause. And we want to say thanks, everyone. Have a great day and stay well.